Well, isn't that fantastic, and congratulations. Let me introduce the award. It is Delivering Value Award, and with me is Tracy Stoker, Director of Operations for Flow and Integration at Medway NHS Foundation Trust, and Dennis Taiwo, Acute Physician, Medway NHS Foundation Trust. This is, the winning entry is the Medway Smart Acute Virtual Hospital, and having read the blurb, it's really interesting, and I've already said it, but I'll say it again, Medway NHS Foundation Trust, and I'm now going to hand over to the sponsor, which is who is Shamil Gunatra, who is the partner at PwC.
Thanks, Victoria. Well, congratulations again on winning this award. As a judging panel, we were blown away by all the regional entries actually, but you were deserved winners, and we're really pleased that you're here. This award, the purpose of it was to recognise outstanding initiatives in the NHS that are improving productivity, improving efficiency, and ultimately making sure that patient care is maximised through every step. We felt your entry excelled in all of those. As a panel, we were looking for evidence of breadth and depth of impact, sustainability, but also scalability, as you said in the video there. I think this can be easily scaled in many places across the country to deliver value, and we felt that your award aligned most closely with the purpose of the criteria and what we were looking for. So congrats again and well done.
Yes, congratulations. Look, when I read through what what you had done, there was an element of it that seemed to me sort of obvious. You know, why haven't people thought of this before? Why hasn't? And we know there are some virtual wards, but you've gone just that step further. I suppose to ask you, Tracy, is where did this come from? What was your thinking?
So we had a successful 12-hour-a-day virtual ward using technology, which we started in COVID with 30 patients. When we grew it to 70 patients, we found that we were getting a lot of doctors, a lot of consultants asking us to take patients that we couldn't take because we weren't monitoring overnight and we couldn't be sure that we would keep them safe overnight. So it was probably about 18 months ago we started thinking, why can't we take more sick patients? Why can't we improve our processes and have that monitoring 24 hours? And Medway NHS FT has been great because they've been really supportive in allowing us to develop something that we recognise isn't really being done anywhere else, and the data for the first 6 months has just been phenomenal, really.
Yes, no, I was just looking at the data. I mean, well, I've got here in just 3 months, you created capacity equivalent to 54 inpatient beds per month and saved just under 5,000 bed days, so a 70% increase on the pre-launch baseline. But I am intrigued, Dennis, about what maybe ethical issues you had to overcome to deal with this.
A lot, I would say. Quite a lot of challenges, ethical issues, governance. But we didn't let these challenges become obstacles to our success. And we saw them as opportunities. And as Tracy said, with the support from senior management and the legal team, we were able to deal with quite a lot of these challenges. As we were discussing earlier, one of them, for a long time we all know about discharge against medical advice, in all of our hospitals, and it's been a long-standing thing, and it's a paperwork. You sign the form, patients go home. But on the virtual ward, we encountered something new. Our patients on the virtual ward deteriorated and declining to come back to hospital for care. So that was one major, ethical challenge, and we had to take it up to the Trust Ethical Committee, to discuss it further, and created a SOP for these kind of patients. So
Give me an example of a patient saying, "No, I'm not going back there." So and you can see the patients declining. So what do you have to do?
Yeah, so we've had a few now, but the very first one, we're not sure what to do because this is the first. We're pioneers in this. There was nowhere to copy from. So it was a patient who was on admission on the virtual ward at home for a pneumonia and deteriorated. And, because of with the technology we use, it enables us to identify deterioration quite quickly because it's a continuous monitoring device. And so that was picked up quite quickly. And an ambulance, was called for the patient to come back to the hospital. But she was in her 80s and declined to come to hospital because no one wants to come to hospital, isn't it? And, she wanted to receive all of the hospital level care we had been giving her. She wanted it to continue, but she was becoming very septic and needed some support in hospital. So we took it up to the ethical committee and with the execs and the legal team. And what we had to do for this patient was we respected her wishes and did.
So she stayed at home.
So she stayed at home, and we did as much as we could for her at home. Things we hadn't done before, we went that extra step to do it for her at home. So again, it's just challenges that make us think out of the box.
So that says to me, Tracy, that there is a degree of flexibility in how this can work. Can you explain that? I mean, what the process that you've had to go through, because every patient is different, obviously.
So I think one of the main success factors for the virtual hospital, and this is something we did when we were a bit more of a standard virtual ward, has always been that we've shied away from pathways. So we haven't said we're going to have a heart failure and a frailty pathway, which is traditionally where virtual sits. What we've said is refer the patient. One of our doctors will review the patient, and we will try and find a way of getting that patient home using the technology. And technologies come on leaps and bounds. There's lots of it. They all do slightly different things, and we were really clear, because our patients are acutely unwell excuse me, that we needed the reassurance of the devices, as Dennis said, to make sure that we were able to see any deterioration really early so that we could make further decisions. So we have, in the 6 months since we've been 24 hours, had over 40 different acute medical conditions for our patients. So, and over, nearly 1,700 admissions from our either ED or medical wards in that time. So, the team will just do whatever we can to
How big is the team?
them. So we're very new. We mobilised quite quickly. So we have, I think we've got about 40 nurses and CSWs and 8 resident doctors.
8 resident doctors, 3 specialty doctors, and 3 consultants.
See, what I'm interested in is I filmed a virtual ward during COVID, but it was patients who were sick but not so sick that they couldn't be monitored at home. But you've actually taken it to a different level.
Yeah, exactly. That's the difference with what we do. We are looking after acutely unwell patients who, would have been in the hospital definitely. And we've taken a few ICU step downs, so patients in ICU who've gone straight home on the virtual ward to continue their care at home with some IV medications and monitoring. So yeah, we've taken it to a different level.
I mean, that's impressive, and you can, I don't mean to not be worrying about the patient, of course, but financially, I mean, the cost saving must be huge.
Yes, Victoria, it has good economies of scale. So the more patients you have within the staffing and medical model you've got, the the cheaper the virtual bed becomes. And because we have a 24-hour nurse-led monitoring team, we can have more patients on that monitoring. So the service costs about the same as 2 physical 25-bedded wards for up to 150 patients.
I mean, a lot has been made in the blurb that we've been given for the awards that this does fit very beautifully into the 10-year health plan. This is exactly the sort of thing that the plan was trying to encourage. Do you think that it's something that can be expanded out across the NHS?
Absolutely, I think it can, and I think it should. Because
does it require, you two, like your enthusiasm, because we know sometimes innovation in the NHS falters because there isn't somebody else who's as keen on it as you are?
Yeah, I think it needs people to be bold, and as I said earlier, support from the management across the NHS as well. We took the bold step, but I think we've done it for everyone now.
Yeah, and interesting that you've dealt with some of those ethical issues already. So when it goes to another trust, you will be able to say to them, look, this is what we encountered, this is how we dealt with it, and so you're giving them a head start, really.
Absolutely. So we've created probably thousands of SOPs and
what's a SOP?
A standard operating procedure. So what we've been doing is we've got a really good suite of data to demonstrate the effectiveness. For example, 95% of the patients who come into the virtual hospital that have been there for the last 6 months have required no re-escalation or no readmission. So, that's really good results. Our incident rate is less than 1%. So we are, as we develop something and we test it and we trial it and we work through it, that then creates that pathway and how we're going to manage those patients. So I suppose in effect we have been the test bed, and other trusts, we can almost box it up and say, okay, this is what we did, this is how long it took, this is what we encountered, this is what it cost, and then other hospitals can put their own slant on it.
Yeah, well, listen, congratulations. I think it's a fascinating project, and you deservedly won the Delivering Value Awards because you can see immediately what the value is. Thank you.
Thank you,
Victoria.
very much.